best on screen television. Ours it is.
The Imole Medical Outreach program had an added value recently with the screening of 355,000 students in the first pilot stage of a comprehensive free healthcare program, out of which 42,000 were discovered with varying eye problems. They were thereafter presented with treated glasses to mitigate and solve the eye defect confronting them. The event, which was a product of multi-sector collaboration, exhibited the commitment of the Adeleke administration to sustainable healthcare delivery, which has earned the governor a number of honors by corporate organizations. It was another forum for Mr. Governor to reiterate his government's desire to extend gestures like this to private schools. The Imole Medical Outreach program did not escape the lenses of Living Spring Update, which analyzed the significance of the state government health initiative. My name is Tomilola Daniel, bringing you episode 22 of the Adeleke administration's positively impacted healthcare policy.
Báwa ṣe wà yìí, banga àtẹ̀tẹ̀ láti máa polongo ìmọ́lẹ̀ torí ìmọ́lẹ̀ ti wà lọ́sùn. A dúpẹ́ lọ́wọ́ Ọlọ́run. Ọlọ́run ló yan Ademola Adeleke kì í ṣe èèyàn. Àwọn èèyàn kan báàkì ẹ̀ ni. Ọlọ́run ló yan. Ọlọ́run tó fẹ́ fún ìpínlẹ̀ Ọ̀ṣun ní ìdẹ̀ra tó dára, òun ló fi mú Adeleke síbẹ̀. Kò ní bàjẹ́ fún ọ. Ẹ sọ pé ìmọ́lẹ̀. Ìmọ́lẹ̀ ni òkùnkùn ti paradà. Ẹ rí báyìí, mo lọ ìpínlẹ̀ kan, ńgbà mo débẹ̀, tí mo ń sọ̀rọ̀ Adeleke, wọ́n ní ha, ọ̀jẹ̀ dákẹ́ mo ní kí n dákẹ́ kébi. Ìwọ lọ Ọ̀ṣun wò, kọ́ lọ wo bó ti rí, kọ́ lọ Ọ̀ṣun wò, kọ́ lọ wo bó ti dà. Ẹ rí pé ọ̀dà Ọlọ́run wà pẹ̀lú yín o. Mo wá ń sọ, mo ní ẹ̀rí bó ti rí ní ẹ lọ Ọ̀ṣun wò kẹ́ lọ wò. Gbogbo àwọn òṣìṣẹ́ ìpínlẹ̀ Ọ̀ṣun, gbogbo wọn náà dúró gbàgìdì pé àwọn ti ń gbádùn. Gbogbo ilé ibi táwa náà ti lọ ta lọ béèrè nílé ìwòsàn, gbogbo wọn náà sọ pé n táwọn rí ti yàtọ̀ fún ti tẹ́lẹ̀tẹ́lẹ̀.
The event brought together under one roof agencies of government relevant to the health needs of people in the state. This time around, government stretched its tentacles to public schools, where 345,000 students were screened for various health challenges. The icing on the cake is that the comprehensive healthcare initiative was carried out free of charge. The pilot stage of the medical outreach fished out 42,000 students of public schools battling various eye defects who were treated and presented with tested eyeglasses. Governor Ademola Adeleke made it clear that his administration will not waver in making healthcare available to the mass of the people. He described the initiative as a leap forward to previous health intervention programs, which have been of tremendous benefits to active and retired public sector workers under the auspices of Osun Health Insurance Scheme, OIS.
Distinguished ladies and gentlemen, it is with great joy that I stand before you today to launch another transformative initiative of this administration, the Imole School Eye Health Program. This initiative is designed to ensure comprehensive eye screening for all pupils and students in public primary and secondary school across the state. Those identified with visual impairment will receive necessary interventions, including corrective eyeglasses, essential medications, and where required, surgical procedures. So far, we have successfully screened 345,000 students, and over 42,000 have been diagnosed with various degrees of visual challenges. I am pleased in I'm pleased to announce that every one of them will receive appropriate treatment at no cost. I repeat, I will announce that every one of them will receive appropriate treatment at no cost. Go offend you, am I going on offend you? I just saw you about offend you. We began this intervention in public schools as a pilot phase, and I assure you that we will soon extend it to private school, ensuring that no child is left behind. In addition to this landmark initiative, we are also unveiling multi-million naira worth of medical equipment acquired through the Osun Health Insurance Agency for accredited government health facilities under the Osun Health Insurance Scheme. This investment is aimed at ensuring that all enrollees receive the highest standard of medical care. Our administration remains resolute in revigilating health sector in fulfillment of our promises. We have fully approved the training allowance for resident doctors and implemented the full commerce and cohesive salary structure for health workers, ensuring they receive their entitlement promptly. We also embark on a massive renovation and upgrading of health care facilities across the state. In just 2 years, 200 out of the 332 focal primary health care centers have been modernized, and the remaining ones will soon follow. In furtherance to those over 25,000 pensioners into the Osun Health Insurance Scheme, free of charge, ensuring that our senior citizens receive quality health care. In the spirit of inclusivity, we have enrolled about 10,000 persons living with disabilities into OHIS and provided thousands of assistive devices, including wheelchairs, some motorists, walking stick, crutches, hearing aids, talking watches, ultraviolet creams, umbrella, and eyeglasses. Our administration recognizes the invaluable contribution of these individuals to our democracy, and we remain committed to that welfare. Furthermore, in response to the passionate appeal of the State Controller of Correctional Service, I have approved enrollment of 1,200 prison inmates in Osun Insurance scheme. This underscores our commitment to ensuring that every resident, regardless of their status, has access to quality health care. The Imole School Eye Health Program, like other health intervention initiated under OHIS, is a testament to our administration's genuine dedication to the welfare of our people. This initiative has positioned Osun State as a trailblazer in healthcare delivery, and it is no surprise that we were recently recognized as the best performing state in the Southwest across all primary healthcare, indices. As a matter of fact, the Bill Gates Foundation and Dangote, we were awarded $500,000. This money we will inject it back to the health sector. It is worth noting that this program is a product of the collaborative effort between the Osun Health Insurance Agency and the Osun State Ministry of Education. I send my sincere appreciation to all stakeholders who made this a reality, including the Honorable Commissioner for Health and Education, the Permanent Secretary of Health and Education, the Chairman Governing Council of TESCOM, Asubed, and the dedicated staff of these ministries and agencies. I also take a moment to express my deepest condolences to Honorable Dr. Muyiwa Meji, Chairman of Oja Governing Council. But on the recent news of his daughter, may her soul rest in peace. May you never sorrow again in life. To my dear Dr. Razak Akindele, I commend you for reviving the Osun Health Insurance Agency and ensuring that our healthcare initiative reach every citizen. Your dedication is invaluable, and I encourage you to keep soaring higher. To everyone gathered here today, I assure you that our administration remains unwavering, and its commitment to delivering people-centered governance. As the popular dream says, good, better, may I never rest till my good is better and my better is best. I will not rest until the best is achieved for the great people of Osun.
The event witnessed the unveiling of another set of multi-dollar medical equipment acquired by the state government to demonstrate its seriousness in keeping the citizens healthy. And Governor Adeleke used the platform to inform the people of the training of resident doctors and the new salary structure that have been finalized. The successes attained by these and other initiatives spoke spectacularly of effective synergy between and among the health and education ministries in pushing the 5-point agenda of government in Osun State.
Wọ́n ṣe dáadáa fún mi o. Bí wọ́n ṣe fún mi lábẹ́rẹ́, bẹ́ẹ̀ ni wọ́n fún mi lóògùn. Àpò mẹ́wàá ni wọ́n powó mi, àpò kan ni wọ́n ní san. Wọ́n sọ fún mi, wọ́n ní gómìnà Ademola Adeleke, wọ́n lò ní ó san yòókù. Ẹ̀yin mo wá wò pé Ademola máa ń ṣe bẹ́bẹ́ nípínlẹ̀ Ọ̀ṣun. Gómìnà máa ń ṣe dáadáa. Kọ́lọ̀ mọ́ bá ń pa o. Bí tí ń ṣe títì ní ṣe gbogbo ẹ̀ nípínlẹ̀ Ọ̀ṣun. Kódà bí tí ń ta gbogbo ẹ̀ káàkiri nípínlẹ̀ Ọ̀ṣun nu. Ó tọ́kọ̀ mọ́ ọkọ mi kó ṣẹlẹ̀ kejì o.
Speaker after speaker at the event were unanimous of a government on the right course in the implementation of a multi-sectoral health intervention program. The Commissioner for Education, Honorable D4 Eluwole, drew attention to the negative effect of eye defect on student performances. The Executive Secretary of Osun Health Insurance Agency, Dr. Razak Akindele, was optimistic on how further interagency collaboration can advance the healthcare delivery efforts of government.
Ẹ ṣé gan ni ẹ kú ìtọ́jú wa àmúre. Mr. Governor, ẹ ṣé gan ni ẹ kú ìtọ́jú wa àmúre. For this wonderful occasion, it has never happened before. There are a lot of things that are happening that you don't know. As a teacher, many teachers that are not trained, they don't know the problem of students. Ideally, in the classroom, we arrange them according to their height. The shorter one will be in the front, while the longer one will be at the back, so that they can be able to see what the teacher is teaching in the blackboard. But many teachers will not know that there are a lot of pupils that are having eye problems. They won't know. So with what happened today, which shows that our governor is caring for the welfare of our pupils. Mr. Governor, once again, thank you very much. If people like Abimbola Salawa Olaitan is physically impaired or visually impaired,
he won't represent Nigeria in Malaysia. If Adeogo Mercy Onyekasola from CAC Grammar School, Bodo for Osogbo, is physically impaired, he won't be part of those who represent Nigeria in Malaysia. If Adewale Olusegun Esther of Ila Grammar School is impaired, physically impaired, he won't be able to represent Nigeria in Malaysia. And lastly, the only one that is a boy among them, Master Daniel Happy Ido Akaba of Master High School in Malaysia. If he's physically impaired, he won't be able to represent Nigeria in Malaysia. The story that I'm saying now, many people don't know. Yesterday was the final stage where we honor those 4 children that represented Nigeria in Malaysia in presidential debate. They took first. They fly the banner of Nigeria in Malaysia. Ladies and gentlemen, I want to inform you that this year, by May, by the grace of God, 4 children of Nigeria are representing Africa in Dallas, USA, in artificial intelligence robotics. If they are officially impaired, they won't be able to represent Africa. Mr. Governor, once again, thank you. On this note, sir, Mr. Governor, I want to beg you, sir, that a letter is on your table already, maybe for an assistance for those that are going to Dallas this year. They need our help. Mr. Governor, I know that you are going to do it for them because by the grace of God, the flag of Nigeria is going to be flying in far USA this year, May, by the grace of God. And they will bring the glory to Nigeria, and it will be your glory. Yesterday, those that went to Malaysia were given the cash gift you promised them, 2 million of them. And we have got down the material information about their admission to Adeleke University, according to your promise. Mr. Governor, thank you very much. Finally, on this note, I want to beg of you, the OEs and the heads, to please extend this opportunity to our teachers. Also, teachers need your assistance. Let us test them. Let us know their problem. They will perform more. Thank you very much.
This is yet another big milestone in the health concern of Mr. Governor for the good people of Osun State. So many interventions before now have been done by His Excellency through our agency, ranging from the free enrollment of pensioners to the enrollment of people living with disability and provision of life support gadgets to them, which cost multi-million naira. The idea of the Imole School Eye Health is construed to bring relief and succor to the students of public primary and secondary school. Quite a lot of students perform poorly in the school, not because they are not intelligent, but because they have problems with their sight. A lot of them do not see what the teacher writes on the board. They do not see what the teacher demonstrates on the board. A lot of them strain to read their books. And what is the result of this? Poor academic performance. It is a concern to Mr. Governor that this must stop, and we must give good sight to our students. We started this exercise about 4 weeks ago. We had a series of meetings with the Ministry of Health on how this will go smoothly. We realized from the statistics that we got that there were more than 345,000 students in this category of schools. When we reported to Mr. Governor, he said we must test all of them and provide solutions to their problem. Looking at the enormity of this number, we agreed that I think the first thing to do is to train the teachers so that they can do school-based training for these students. So for about a week, we engaged the teachers, more than 400 teachers. We trained them how to use visual acuity charts to detect eye challenge in a pupil. And for the following week, they carried out this exercise. From statistics from studies that have been done before, if you screen about 345,000 people, you are likely going to get about 22,000 that will have challenges. We made provision initially for 25,000 students. Unfortunately, as I'm talking to you now, we have reached 45,000 students that have high challenges. We ran back to Mr. Governor and he said all of them must be provided for, that he was ready to give us the maximum support. Also, quite surprisingly, we discovered quite a number of students that have near blindness. In fact, there were some of them, about 4, that have almost complete retinal detachment. It means that they can only perceive movement. They cannot see the structure that is moving. And if that retina detaches completely, then that person cannot see again for life. We have discovered about 4 of them. The thing about them is that these 4, their schools were very close to their homes. And if not, they would have been locked down by vehicles before now. So as it is, we are making provision as approved by Mr. Governor for these 45,000 people that have challenges with their eye, including those who will need drugs and those who will need surgery. Some of these surgeries will not be done in this state. It means some of them will have to be exported for this surgery. Thank you, Mr. Governor, for this gesture.
It is commendable that Osun State government continues to invest in the health needs of the people, particularly as such are related to the youth population. The Imole Medical Outreach program also brought the need for continuous training of teachers to detect eye challenges among students. This is a recommendation supported by a consultant eye physician, Dr. Modukwe Adebayo.
We gather for a momentous occasion, the symbolic presentation of corrective glasses and vital eye medications to our cherished pupils and students, and the distribution of essential medical equipment to our OIS accredited government hospitals. This is a day of profound significance, a day where we witness the tangible impact of visionary leadership and unwavering commitment to the well-being of our people. As a consultant ophthalmologist with over a decade of experience, I have witnessed firsthand the transformative power of sight. For far too long, many of our children have struggled in the shadows of undiagnosed visual impairments. Students labeled as dull were not lacking in intellect, but in clarity. The Imole School Eye Health program, under the esteemed sponsorship of His Excellency, has illuminated this darkness. Let me share a brief story. Young Adeola, a promising student, was struggling in her studies. Her teachers were concerned. Her parents worried. After a simple eye screening through this program, it was discovered she had eye myopia, and her new glasses was given. Adeola's grace soared, her confidence blossomed, and her dreams were brought into sharp focus. This is just one of the thousands of stories that paint the picture of the program's impact. Over 345,000 primary school pupils and secondary school students were screened, and an outstanding over 40,000 pairs of corrective glasses will be distributed. Furthermore, necessary eye medications were provided, ensuring comprehensive care for these children. This achievement is a testament to the dedication and efficiency of the Osun Health Insurance Scheme and the unwavering support of our governor. Your Excellency, you have not just provided glasses, you have provided a window to a brighter future. You have not just distributed drugs, you have dispensed hope to these children. Truly, Imole has come to Osun State, illuminating the path to knowledge and opportunity. You have emancipated our children from the darkness of visual impairment. This program is not merely a short-term intervention. It is an investment in the future of Osun State. It improved literacy rates, a more productive workforce, and a reduced burden on our healthcare system are just some of the long-term benefits of this program that we reap afterwards. Therefore, on behalf of the thousands of pupils and students whose lives have been transformed, and on behalf of every citizen who believes in the power of education and health, I extend our deepest gratitude to His Excellency, Governor Ademola Jackson Adeleke. We applaud your commitment, your compassion, and your unwavering dedication to the people of Osun State. We call upon you to continue this good act and to further expand the life-changing program. Thank you, sir.
Many of those who attended the event, among them students, said as direct beneficiaries, they can testify that the Adeleke administration has focused on healthcare, which is pivotal to human development.
And on behalf of myself and all the students in public schools, we say a very big thank you for the glasses given to us. We want us to attain a certain height. We want us to reach the future purpose. That is why you gave us another assistance for us to improve in our educational services. In our academics, it's a little difficult for most of the students in Osun State to read their books or to face many challenges under academics. But with the help of these glasses, free glasses given to us, we'll say a very big thank you, sir. We pray that may God Almighty God continue to bless you. He will continue to protect you, and you and your family will never lack any good thing. We say a very big thank you, sir. And God will continue to bless the work you have done and the work you have in plan to do in Osun State.
Students with eye problems no longer have to worry about good vision within and outside the classrooms. Parents of those students no longer need to worry on cost of providing medical treatment and treated eyeglasses for them. Teachers need not worry of the stress of getting students with eye defects to keep pace with those whose eyesight are okay. Meanwhile, students in private schools with eye problems will no longer wait for long to benefit from the state government's magnanimity. All courtesy of a purpose-driven administration of Governor Ademola Jackson Adeleke. This is a cotton drawn on Living Spring Update, episode 22 for this week. On behalf of my production crew, I am Tomilola Daniel, signing off till next week. Bye for now.
Living Spring Update is a production of the Office of the Spokesperson to the Governor, Governor's Office, Osogbo.
Shine.